My name is Alix Arnaud. I work at Sanofi, and I am a health economics and outcomes researcher. So that is quite broad and a bit of a nebulous term for some, but my role really is to conduct studies to look at the real-world evidence around pharmaceutical products, evaluate efficacy, look at disease burden, unmet need, but also look at the health economics.
Start with abstract 2582. Can you give us an overview of this abstract?
So this surgical cost poster, an abstract, looked at Altuvio's costs when used in the perioperative management of patients with hemophilia A. So Altuvio is first-in-class high-sustained Factor VIII replacement therapy. It is approved in the US for adults and children for both kind of prophylaxis use, so once weekly, on-demand treatment to treat bleeds, but also for perioperative management. And so in this poster, what we wanted to do was take a look at the cost of surgery and surgical management in terms of the factor cost when using Altuvio or efanesoctocog alfa versus standard of care, so extended half-life therapies and SHLs as well. So within this, the math is actually quite simple. Patients who come in for surgeries with hemophilia A will receive factor therapy before, during, and after surgery. It is a component of the entire cost of surgery, and it's not insignificant. And therefore, what we did in this analysis was look at the total cost of factor utilization before, during, and after surgery when using an SHL, an EHL, or Altuvio. We used all clinical data from the USPIs, so the labeled clinical studies that are in the FDA labels. From those clinical studies, we obtain the data in terms of what is the average consumption of factor for each of those types of therapies, and then we calculated out what is the cost using the wholesale acquisition cost. Now, within the poster, what you'll see and within the abstract is a total cost, total consumption by patient. And really the findings were that with Altuvio, patients received a lower volume of total factor around that entire perioperative management period. And that resulted in a lower total cost relative to doing that perioperative management with SHLs or with EHLs. So really that's the abstract in and of itself. But the key takeaway there is that treatment with Altuvio requires lower volume of factor to be infused. And therefore, once you take into account the cost, the total cost of that factor usage around the perioperative management period is going to be lower with Altuvio than it is with an SHL or EHL. I think within the US system, cost is always something that hospitals, physicians, or groups may consider. So we thought it was important to put that information out there. One of the considerations or questions that we were trying to answer here is what is the cost component in terms of factor usage? It is, as I said earlier, it's not an insignificant portion of surgical management, and therefore we thought it was important to do the calculations.